Today's topic of discussion is HIV and antiretroviral drugs. So we are going to learn about this drug in a similar way in which we studied about the other non-retroviral drugs. First, we'll be talking about the structure of HIV, which is quite important, and then we'll be looking at the life history of an HIV virus, and then we'll put in the drugs. So let us begin first with the structure of an HIV virus. So before we begin to talk about the structure of HIV virus, you should know that in the world, there are two viruses associated with AIDS, which is acquired immunodeficiency syndrome. One is HIV-1 and HIV-2. So most of the HIV infections worldwide, they are caused by HIV-2 virus, HIV-1 virus, while HIV-2 infections occur in Western Africa and India. But the second strain, which is the HIV-2, it doesn't show any it shows virulency, but it's not that as great as the HIV-1 virus. So with this certain points about the HIV, let us talk about the structure of an HIV virus. Like all the viruses, this particular virus also has an envelope of lipoproteins. Right. So this is an envelope of lipoproteins. Now, the unique thing about this envelope is that it contains certain glycoproteins that helps in the entry and fusion of this virus to the host cell membrane. So we are going to draw that. So there are vertical stalks like this on the virus. These are referred to as transmembrane stalks, which are nothing but glycoproteins, right? And these glycoproteins, they help in the viral attachment to the CD4 plus cells of T lymphocytes. The favorite cell of the HIV virus to go and attach itself is your T lymphocytes, the T helper cells, because they have got CD4 marking on them. Now this particular vertical stand that I have drawn, this is your glycoprotein 41. All right, and it is called as transmembrane stalk. Now, attached to this GP41 or the transmembrane stalk is a rounded knob-like button. Now, these rounded knob-like buttons that you are seeing, these are also glycoproteins, and they help in attaching themselves to certain co-receptors present on the host cell surface. So these are glycoproteins, and they are termed as GP120. GP stands for glycoproteins. So let me finish up with drawing the knob-like structures, which are GP120, and they are attached to your transmembrane stalk, which is referred to as GP41. So let me write the name of this, and it's called as GP120. Right. These are knob-like glycoproteins, like knob-like. Now, uh, so these GP41 and GP120, they are antigenic in nature, and they facilitate the viral attachment to CD4 plus cells of T lymphocytes. Right. Now, moving on, after this, we have got a layer of capsid, which is nothing but also a layer of proteins, and we are going to draw it in green. right? This is similar to the other viruses that we have studied, and this is referred to as capsid, right? Now, after this comes the core genome, right? This is the core genome, and it contains the genetic material of the virus, which is a single stranded RNA, right? Now, apart from this virus having single stranded RNA, it also possesses certain enzymes in it, right? Now, before we talk about the enzymes, let us talk about certain genes that are, very much important for the virus, right? This RNA virus, along with it, has got three genes: RNA plus three genes inside the core genome. Now, the first gene that I have is called your GAG gene, right? And the other gene is called your POL gene. Both of these genes, they code for certain enzymes which are essential for virus survival. And the enzymes are, first is reverse transcriptase, right? Now, this reverse transcriptase is attached to the genetic material. Let me show you how. So this is your single stranded RNA, and to it is attached the reverse transcriptase, right? Now, this particular reverse transcriptase is coded by a gene which is present in the core genome called the GAG and POL gene, right? Secondly, we have another enzyme which is called as integrase. So if you want to put integrase in black, you can, and this is referred to as integrase, right? Now, the third enzyme that these genes, GAG-POL genes, code for is called your protease. Right? Protease enzyme is very important because it causes the maturation of the virus particles. Right? So this is integrase, this is your reverse transcriptase, and this is your protease. So all these three enzymes that I have drawn, they are coded by GAG gene and POL gene, right? And we call them GAG-POL genes. Now, there is another enzyme, there is another gene, and that is referred to as ENV gene, right? And this ENV gene, it codes for the glycoproteins GP120, which is your knob-like structure, and secondly, it codes for GP41, which is your transmembrane stalk, right? So this is about the structure of a virus. Now, apart from this, you have to know what are the cells that an HIV virus can infect. So the cells of the immune system that the virus can infect, they include T lymphocytes, they can infect macrophages, they can infect the Langerhans cells, and in advanced cases, they also infect the dendritic cells of CNS. So remember these four cells which the HIV virus can infect. Right. Now, before we move on, let me put a small point regarding macrophages. Just remember this point at this point. Just remember this at this point that macrophages, they have got a receptor which is called as CCR5. So on the cell surface of macrophages, we have a receptor which is called CCR5. Now, in a few minutes from now, we are going to know what this thing means. After we are done with the structure of virus, HIV virus, with the GP120, GP141 on the envelope of proteins and the capsid layer, and the core genome containing the genetic material, which is single-stranded RNA with the three enzymes, integrase, protease, and reverse transcriptase, which are coming from the GAG-POL genes, and the ENV genes that are coding for the glycoproteins 120 and 41. The main cells that the virus attacks is your helper T cell with CD4 plus epitopes. So quickly now, let us move on to the viral replication, HIV replication in the host cell. So let us talk about the replicative cycle of an HIV virus. Right. So like we learned about, like we discussed about the DNA and the RNA viruses in our previous class, let us in a similar way talk about the replicative cycle of an HIV virus. So let me first draw a cell. This is the place where the release of virions takes place. And then we have the process of endocytosis, right? It's not that great, right? And then after having drawn this, let me name this cell as helper T cell, helper T cell with CD4 plus epitope. Because these are the favorite cells of an HIV virus. Now, after having drawn this, let me also draw the plasma membrane of this particular cell. And the plasma membrane, it extends from here till the last. So let me name this as plasma membrane. And on the plasma membrane, there are present certain receptors, right? And those are called as CD4 plus and CXCR4. Right. So let me draw the CD4 plus receptor. Right. So this is your CD4 plus. And attached to it is another co-receptor. And since we are talking about a helper T cell, we are going to name this as chemokine co-receptor. And it is called as CXCR4. Now, if this were a microphage that we are talking about, instead of a CXCR4, we would have got a CCR5, right? So this is the importance of these receptors. So these receptors are present on the plasma membrane, and this is the point of attachment of the virus, right? So since we're talking about the helper T cell, we have to talk about the CD4 plus on the plasma membrane and also CXCR4. Now, moving forwards, we have to discuss how the virus attaches itself to these receptors. Now, so let me draw another virus particle for you, just in summarized way. This is the envelope. Let me write it as E. This is the capsid layer, and this has got the core genome. Now, what happens is, now this is the transmembrane stock, which is the glycoprotein 41, and this is your GP 120. So as you can see, the GP 120 and the GP 41, they are responsible for the fusion or the integration fusion of these glycoproteins with the cell surface receptors of the host cell, right? After this particular step is done, comes in the process of endocytosis. So as you mentioned about, as we discussed about the life cycle of the DNA RNA viruses, in a similar way, the process of endocytosis occurs. So you have got a virus now, right, with its glycoproteins, and its capsid layer and its core genome. Now, after this, what happens is the virus goes inside and starts the process of uncoating. In a similar way as we discussed about the RNA viruses in the previous class. So after the process of uncoating gets over, what happens is it proceeds towards the process of actions of the different enzymes that the virus has. So let me draw a virus particle for you. So this is a single strand RNA, and to it is attached your reversed transcriptase. Now, what happens is this particular reverse transcriptase now will convert this single stranded RNA into a double stranded viral DNA. Look, so this is the point where I'll be writing reverse transcriptase action. So it converts a single stranded RNA into a double stranded DNA. So this is the action of reverse transcriptase enzyme, which is quite unique to the HIV virus, right? So after the process of viral DNA production is done, this viral DNA has to be incorporated into the host cell DNA. So for that, they have to be shifted to the host cell nucleus. So let me draw a host cell nucleus for you, right? And this particular host cell nucleus contains its own DNA, right? Now it's busy, just moving about in the host cell membrane. And what happens is this viral DNA, sorry, this double-stranded viral DNA now has to get incorporated into the host cell DNA. Now, how does this process occur? If you remember, the virus has got another enzyme which is called as integrase, right? So what integrase does is integrase action. So what integrase does is it will incorporate this double-stranded DNA into the host cell DNA, like this, right? So this is called integration, and the resultant product is called a provirus, right? Now, this provirus can undergo two steps, right? The first step is that this provirus can now undergo the process of it can be transcribed into mRNA, right? And also this can be shifted out as a genomic RNA through other processes, right? Now, this mRNA is now shifted to the host cell ribosomes. As discussed in the earlier chapter, we have got ribosomes, and this mRNA now undergoes translation. And when the process of translation is done, what happens is the resultant compound we get are your viral proteins. Now, there are a number of steps that happens at this particular juncture, and that is this is a place where the genomic RNA and the viral proteins and they are matured and matured to form virus particles. Now, this whole process of the genomic RNA interaction and the production of viral proteins is caused by a viral protease enzyme. So over here, this genomic RNA and the viral proteins, they have got bombarded with protease enzymes, which are also unique for the HIV virus. And these protease enzymes, what they do is they initiate a process of maturation in which it cleaves the newly formed polypeptides or proteins into functional structural proteins and viral enzymes. Right. And the resultant mature virion then buds out to infect the other susceptible cells until eventually the immune response fails. So this particular protease enzyme is responsible for the maturation and the formation of structural proteins of the HIV virus and also the different viral enzymes, which are your integrase, protease, and reverse transcriptase. So the resultant product here will be a newly formed virus particle, also called as virion, with its glycoproteins. Then it also has got your capsid layer, and it has got your core genome with the integrase, protease, and reverse transcriptase. And after this, they are released into the host body to infect the other cells. So this is how the replication of a HIV virus occurs in our body. Now, before we move on to the before we move on discussing about the drugs in detail, let us first discuss certain classification of the HIV drugs, right? So classification is quite simple, right? Classification of HIV drugs. So the first drug that we have over here is called your nucleoside reverse transcriptase inhibitors, which are called as NRTIs. And the drugs that we have are your zidovudin, stamivudin, lamivudin, and abacavir. So what this nucleoside reverse transcriptase inhibitors does, as the name itself indicates, that it has got something to do with the reverse transcriptase enzyme. So the action of this NRTI drugs will happen at the level of this particular step. It will inhibit the action of reverse transcriptase so that the double-stranded DNA is not formed and it cannot be integrated into the host cell DNA, right? The second group of drugs that we have for HIV are called your non-nucleoside reverse transcriptase inhibitors. And the drugs here we have are efavirenz, then we have got nevirapine, then we have got delaverdin, and also etravirin. Right. The unique point about non-nucleoside reverse transcriptase inhibitors is they directly bind to the catalytic site of the reverse transcriptase. There is no need for them to get phosphorylated into their active metabolites, unlike in the case of nucleoside reverse transcriptase. So again, the second group of drugs, they also act at the level of reverse transcriptase. Now they act at the level of the catalytic site of reverse transcriptase. Right. Now the third group of drugs that we have for anti-HIV, they are called as nucleotide. These were nucleoside. These are nucleotide reverse transcriptase inhibitors. Right. And we have just got one drug which is called as tenofovir. And you might be already guessing again these drugs, they also act at the level of the reverse transcriptase. So we have got number one drug acting at the level of reverse transcriptase, number two drug acting at the level of reverse transcriptase, number three drug again acting at the level of reverse transcriptase. So imagine the uniqueness of this reverse transcriptase action and the fear that it instills in the human body. That is the importance of this reverse transcriptase enzyme, which is important for the virus. Right. Now, coming to the fourth type of drugs that we have, and they are referred to as protease inhibitors. Right. Now, these protease inhibitors, we have got a very long list of them. By We have got at least 10 of them, but if you remember at least 5, it's more than enough. And the first drug that I'm going to discuss is your saquinavir, and other is indinavir and nelfinavir, and after that we have got ritonavir, and we have got other drugs which also end in avers. All right. So these are your protease inhibitors, and as the name itself indicates, you already know where they work. They work at the level of the protease enzymes. And when they inhibit the protease enzymes, the most important step of this genomic RNA coming and the structural proteins being formed doesn't happen, so that the new budding virions are not produced and they are not released into the host body. Right. So that is the importance of protease inhibitors. Now, lastly, we have got a few drugs. The fifth drug that we have are your entry fusion inhibitors. Now, for the entry and for the fusion, I've already told you that GP. Okay, for the fusion of for the fusion of the virus to the host cell, we have got GP41 that causes the fusion envelope with the plasma membrane, right? And so let me here just write it down for you that GP120, glycoprotein 120, it helps in binding to the host cell, and GP41, it helps in the fusion of the envelope of the HIV virus with the plasma membrane of the host. So we have got here drugs which are entry fusion inhibitors, and so the drug that we have here is your enfuvirtide. Now, so as you have already make sure that these enfuvirtide should act at the level of the GP41. So this is where your number 5 drug, which is your entry fusion inhibitors, they work. Now coming to the sixth group of drug we have are your CCR5 inhibitors. So if I were in a macrophage cell and if the virus was attacking me, I would be acting at the level of the CCR5 inhibitors, CCR5 co-receptors. And this is where your drug 6 acts. And the name of this drug is maraviroc. Then lastly, we have got this enzyme remaining, and that is the point where the number 7 drugs act, and they are referred to as integrase inhibitors. Right. So what are the different drugs that we have? We have just got one drug over here, and that is called as raltegravir. Right. So let us look at the classification of the HIV direct drugs again. We have got nucleoside reverse transcriptase inhibitors that act at the level of the reverse transcriptase. We have got zidovudin, stamivudin, lavivudin, abacavir. Then we have got non-nucleoside reverse transcriptase. They act particularly at the catalytic site of the reverse transcriptase. We have got, and they don't require phosphorylation to an active. And the drugs are efavirenz, nevirapine, delaverdin, etravirin, and there are other drugs also. Then we have got nucleotide reverse transcriptase inhibitors. They have just got one drug to deal with, and that is tenofovir. Now coming to the protease inhibitors, they act at the level of the protease enzymes at the last step of the viral replication. Then we have got entry fusion inhibitors, right? And the drug is enfuvertide. It acts at the level of GP41. Then we have got CCR5 inhibitors, maraviroc, which are one of the two co-receptors. The first co-receptor is chemokine co-receptor 4, and if we are dealing with a macrophage, we would have a co-receptor called as CCR5, right? So these are your CCR5 inhibitors, and then lastly we have got integrase inhibitors, and the drug is raltegravir. Now, after we have learned about the classification and the life cycle, it is quite easy for you to understand the individual drugs, right? So quickly moving on, let us talk about the nucleoside reverse transcriptase inhibitors, which are your zidovudin, stavudin, lamivudin, and abacavir. There are also other drugs. If you want to include, you can include zalcitabine. You can include ntricitabine, and then you can include diadenosine, right? So these drugs are first converted to their active triphosphate form, right? Like the other non-retroviral drugs that we discussed in the last class, by host cell kinase enzymes. Kinases, that means they are going to phosphorylate this into an active metabolite. So now the triphosphate form, it competes with the viral nucleoside triphosphate for their access to viral reverse transcriptase. And when they competitively inhibit this viral reverse transcriptase, they are going to stop the production of complementary DNA from the viral RNA. So that is how these drugs act. Now, apart from this, these drugs also lack OH group, and they have an azido group. They do not have an OH group, but they have an azido group, and as a result of which they are falsely incorporated into the growing viral DNA chain, resulting in its termination. So these are the two steps of mechanism of action by which nucleoside reverse transcriptase inhibitors act. Now, looking at the uses, they are used primarily in what we call a highly active antiretroviral therapy. Now, what happens over here is that we have to include two nucleoside reverse transcriptase inhibitors and one non-nucleoside reverse transcriptase inhibitor, or we can include one or two protease inhibitors. So this is the regimen that is followed for highly active antiretroviral therapy for a person who has been infected with HIV virus. Right. Now, there are also other regimens, and in which we can include two NRTIs plus one protease inhibitor, or we can also include two NRTIs, nucleoside reverse transcriptase inhibitors, plus one NNRTI. Or you can also go in for 2 NRTIs plus 2 protease inhibitors. So these are the regimens that are usually followed, but the main regimen that is followed is the combination of drugs of 2 nucleoside reverse transcriptase inhibitors plus 1 non-nucleoside reverse transcriptase plus, or it can be a protease inhibitor, right? So let me write down a few drugs for you. So we have got zidovudin, right, which is a nucleoside reverse transcriptase inhibitor, plus lamivudin. So you have already taken care of the 2 NRTIs, and then it could be 1 NNRTI or it could be a protease inhibitor. So in this case, let us include efavirenz. Efavirenz is what? Efavirenz is a non-nucleoside reverse transcriptase inhibitor, right? Now this is one of the regimen that is followed, or you can also include zidovudin again plus lamivudin. Now these includes your 2 NRTIs, and you can go for either lopinavir or ritonavir. These are what? These are your protease inhibitors. So I have given you 2 regimens with 1 NNRTI, and I have given you the second regimen with protease inhibitors. So these are called as HAART therapy, and they are an important viva questions for your finals, right? Now we have got another alternate regimens also, and let me write that in another color, and in that you include one of each, or one of NRTI, one of NNRTI, plus 2 of protease inhibitors. So this is what we call as highly active antiretroviral therapy, which is a combination of different groups of drugs acting against the HIV virus. The regimen that is still followed is the number 1, right? Uh, these drugs, they are prone to cause lactic acidosis as an adverse effect, and severe hepatomegaly and hepatic steatosis, right? So these are the adverse effects, the important adverse effects of these drugs. Now quickly moving on, let us talk about the non-nucleoside reverse transcriptase inhibitors. As we have already discussed, they act at the catalytic site of the viral transcriptase enzyme, right? So they do not require activation through phosphorylation. That means they do not get converted into the triphosphate forms, right? And the moment they enter, they cause inhibition of the viral DNA synthesis by acting at the catalytic site. Remember this point, this is quite important. Now uses, they are active against HIV-1 reverse transcriptase only. Now what are the adverse effects? Now the adverse effects, they owe it to the Stevens-Johnson syndrome in the form of rashes on the body, and there might be elevations in the levels of liver enzymes seen. Since primarily all these drugs are metabolized in the liver, there will be hampering of the liver enzymes. Moving on to the nucleotide reverse transcriptase inhibitors, NTRTIs. Now the mechanism of action is quite simple, because the drug that we have, tenofovir, it exits in its prodrug form, and the prodrug form of this drug is your tenofovir disoproxil. Now this tenofovir disoproxil fumarate is first hydrolyzed in the liver, and when it is hydrolyzed, it becomes tenofovir, and this tenofovir gets phosphorylated to tenofovir diphosphate that competes and inhibits the HIV-RT enzyme. And when it does that, it will terminate the chain elongation after getting incorporated into the viral DNA. Now, what are the uses? They are used along with the other drugs. They cannot act alone. They have to be taken along with other drugs in a dose of 300 milligram once daily. And adverse effects are nausea, vomiting, diarrhea, and osteomalacia. So remember not to give these drugs in patients already having calcium deficiency. Now, moving on, We have got protease inhibitors, and these are a long list of drugs. I have written only 4 of them, but if you want, you can also include over here atazanavir. Then we have got tipranavir. Then we have got darunavir. Right. Now the mechanism of action is quite simple. They inhibit the viral protease enzymes and prevent the cleavage of GAC-Pol polyproteins. That I've told you in the last step that the protease enzymes, they initiate a process of maturation in which newly formed polypeptides are converted into functional structural proteins. So the name of those polyproteins are your GAC-Pol polyproteins. Now, when it prevents the cleavage of this, functional structural proteins of the virus are not formed, and when they are not formed, new virions are not produced. So that is a simple mechanism of action of protease inhibitors. They are used in combination with NRTIs in HAART regimen that we have already discussed in the previous slides. The adverse effects include diarrhea, nausea, abdominal discomfort. So if you see, these are all pure GI disturbances, right? And then they have an effect on the metabolic processes of the body. They hamper the metabolic physiology, leading to hyperglycemia. There will be altered fat distribution, and then there will be hyperlipidemia. So this is glucose and the lipids, what they hamper. Now, lastly, let's talk about the fusion entry inhibitors. We have got just one drug, which is enfuvirtide. It is a polypeptide that binds to the GP41 because GP41 is responsible for the fusion of the viral glycoproteins to the host cell. And when it prevents that, it prevents the entry of HIV into the CD4 plus cells by interfering with the fusion of the viral and the cellular membrane. Now, where is enfuvirtide used? It is used for advanced HIV infections. Adverse effects usually include local reaction where you inject this drug. There might be skin rashes in some individuals. And the thing that you're likely to remember is eosinophilia is caused by this particular drug and pneumonia-like manifestations. So remember this important adverse effects with respect to enfuvirtide, which is your fusion entry inhibitor. Now coming to the chemokine receptor 5 or CCR5 antagonist, we have got one drug which is maraviroc. Now the drug binds to the CCR5 receptor, one of the two core receptors, the other receptor being your CXCR4, which is your chemokine co-receptor, which is present on the helper T cell. Now these are present on the CD4 cell membrane also on the cells having the CD4 epitopes. There might be some other cells also which have got CD4 epitopes apart from T lymphocytes. And what they do is they prevent the entry of the virus. So what it basically does is it prevents the interaction of viral GP20 with the CCR5 co-receptor. So when there is no interaction, the virus cannot get inside or cannot bind to the cell membrane. So where do we use it? We use it along with other antiretrovirals in highly resistant cases. So in patients who are immune or they are have become resistant to the other HIV drugs, maraviroc comes as a rescue. Adverse effects is it's highly severely hepatotoxic, and apart from this, it can also cause cough, rash, fever, and GI distress in individuals. Now coming to the integrase inhibitors. The integrase is an enzyme that causes the integration of the viral DNA into the host cell DNA. So these drugs, what they do is they inhibit the viral enzyme integrase, preventing the insertion of HIV genetic material into the host cell. And when it is done, they halt the viral replication. So they are used along with antiretrovirals in highly resistant cases. Highly resistant as in the patient might also be suffering from tuberculosis. So in that scenario, what you have to do is you have to start with the TB regimen, anti-TB regimen, and then you have to start the HIV therapy. Now, what are the adverse effects? They cause nausea, fever, headache, and myopathy. You might be thinking, the adverse effects are quite simple. It's causing just nausea and fever and headache. But what you have to remember is that the uh, the therapy, pharmacotherapy of anti-HIV regimen is not just for a few days or a few hours or for a few weeks. It extends for months together. And imagine you having nausea for months together, you having fever for months together, then continuous headache. You don't want to survive, or you don't want to live in those situations with the adverse effects of these drugs. And most importantly, they also have some life-threatening adverse effects also that happen with certain individual drugs. So you might be noticing the adverse effects being very simple, but imagine them having the patient having tolerating them for months. So you have to take that into consideration. So apart from this, these are the last drugs that we have. Apart from this, there are some other drugs that are in the pipeline, which are still in the phase 3 of clinical trials. And one of the drugs that we have over here is your Bevirimat. Bevirimat is basically a mutation inhibitor that acts at the last step wherein maturation, sorry, not mutation, it is maturation. It is a maturation inhibitor, and it acts at the last step wherein maturation of the virion particles are taking place, and it inhibits that process. Then we have got other drug which is called as elvucitabine. This is a new nucleoside reverse transcriptase inhibitor in phase 3. Then we have got lastly Vicriviroc. This is a CCR5 co-receptor antagonist. Then we have got lastly L-white gravel, which is an integrase inhibitor. So if you want, you can also write over here L-white gravel. Right. So with this, we conclude our chapter on HIV and drugs acting against the HIV virus.